How was your stint in the hospital? What happened there?
Oh, it was lovely.
Yeah.
Yeah, his food was great.
I genuinely enjoyed my week when I was in hospital psychiatric ward when I was 18.
No,
I'm not joking. Like, I found it very helpful.
No, I could understand that for sure. No, mine was it was not great. It was just depressed, and the awesome doctor just diagnosed me with bipolar when I was sleeping.
What?
Yeah.
When you were sleeping, what does that mean?
Yeah, apparently, he checked up on me.
Mm-hmm.
I mean, I think I was so out of it that I guess he talked to me, but I had these new meds prescribed when I had this outpatient checkup.
Yeah.
They're like, we're going to start you on this. I was like, no, these are mood stabilizers. I was like, God damn it. Like, I've been forthcoming for years now that I am not bipolar because what you're doing is you're taking symptoms of an alcoholic as if I was not drinking.
Exactly.
That's what, then I'd be. But even then, I don't have the mania. But
yeah, I was about to say, you're never manic.
It was just like, imagine me just slopped over in bed and just he's on his little cart with his computer and she's like, I diagnose you bipolar. And then he just carts away. I was like, God damn it. And so
then they put you on mood stabilizers for bipolar. Are you taking
They
them?
offered them, and I didn't take them because I was just like, no.
Do you tell them I'm a fucking addict and my mood instability is because of probably that?
Yeah.
Yeah.
And it was just that's...
what is it called when you have only the depressive side of bipolar?
Well, there's bipolar 2, which that's more the depressive side, and that's supposed to be really less mania or maybe even no mania. That's what they thought for me. But there's still something about it though, like mood swings that I didn't have. And it's just like...
So you do have a mood instability issue that wasn't always there?
My mood swings, I guess it was characterized poorly. My mood swings weren't sort of wild into anger or fleas of glee or something like that.
Mm-hmm.
It was just me going to normal to sad, really, really sad really quickly.
The mania would be nice sometimes.
I know, fuck,
dude. Give me a little mania once in a while.
I know, exactly, right? It's all come down, no cocaine. But anyways, it was just I'm actually going to file a complaint for this doctor.
Reckless diagnosis?
Well, no, I've dealt with him for a long time. He's just, the thing is, he's too busy. The board needs to look at his schedule. He does so many things that he cannot adequately treat patients.
Yeah.
I mean, it's crazy. It's not possible. There's 4 different clinics that these different things. He does CTE treatments and he does this outpatient treatments and he does all this stuff. And it's just every time he's been with me, you're just and I'm just
you've had many multiple diagnoses throughout your life that have been kind of bullshit. I remember the schizoaffective disorder or the schizophrenic.
That's him.
Same guy?
Yeah.
Just throwing everything at the motherfucking wall.
Every time I see it, I'm just God damn it. I see his name and I go,
I'm going to get diagnosed with some new fucking disorder.
or just okay, well, I'm just going to say sad and that's it.
What meds are you on?
Flintstone chewable.
Nice.
Wellbutrin and Cymbalta.
And what are those two for specifically?
Wellbutrin is...
Classic SSRI, I believe.
I don't think it's the SSRI. I think it's just pure antidepressant. Maybe, I don't know. Anyways, I've been on that for a while. Mm-hmm. And then Cymbalta is another one that's supposed to be it can be paired with something.
So kind of reinforce each other?
Yeah.
Let me look that up real quick.
I took a gene study, and that's when I found out that I metabolized antidepressants very poorly.
Really?
Yeah.
So what does that mean for your dose?
So it means that I take folic acid. I have to take this extra amount of folic acid.
That's just a vitamin, basically?
Yeah, to help me hopefully metabolize the antidepressants. But
so Cymbalta is a serotonin norepinephrine reuptake inhibitor.
Yeah.
So instead of just an SSRI, it's serotonin and norepinephrine.
Yeah.
And then, Wellbutrin, I think maybe my dad was on that. It's pretty popular.
Yeah, Wellbutrin's all in the mix.
And that is a NDRI antidepressant.
Bupropion.
Do you ever have side effects from any of those meds?
Yeah, I have some weird sexual things.
Really?
Yeah.
Just getting too hard too often or what?
No. The dick is too big.
Oh, too big. Classic problem.
No. It's a weird thing with...
The dick is too big.
Yeah, right? It's a weird thing with ejaculating.
I watched Dave get a hand job once.
Yeah?
Remember that? I won't say her last name, but Alex. in your basement?
Oh, yeah.
And we were all sitting out by the pool table, and then the door fell open?
Harsh knuckles.
Really?
No.
Okay.
I thought it was funny to say. No,
I saw his little dick getting jerked.
Yeah. It was like plucking a mushroom.
It was beautiful.
Yeah. But anyways, yeah, just weird thing with climaxing, where sometimes it's like, we're going to do it? Actually, never mind.
Now, that's a purgatory that I don't ever want to be stuck in. I mean, that's a forced edging where you can never...
It's weird.
Come to culmination.
Yeah. So much of my life is just not like, just edging.
Wait, what is that? Does that frustration, like you just don't nut for that night? You just have to give up?
Well, it's not. I don't masturbate. I'm so sexually active with my girlfriend.
Oh,
ladies.
wow. Bragging.
No, really. But it's nice. But it's weird.
I mean, that would fucking be a sort of torture to not be able to climax.
Because then sometimes she internalizes. I'm like, no.
Yeah.
It's just because I'm crazy.
Which
also you should be worried about.
You're definitely more worried about that.
Yeah.
You stay hard, but you just can't bust?
No busty.
But you stay hard.
But then eventually, after a certain amount of time, it goes down.
It goes down?
Because it's just like, oh, well.
It goes from 10 inches back to its...
You're not paying overtime.
It goes from 10 inches back to its baseline 6.
Actually, there's like... They can do operations where like half of your dick is almost kind of like an intestine, where almost nearly twice the amount is inside of you, so they can cut it and pull it out.
Pull that fucker out.
I could be looking at 6 inches.
That's a quadrupling of his current dick size.
Mm-hmm.
Is it big? Is it small? Who knows?
It's small.
So you have derealization.
Yep.
You had a relapse on DXM, but
can't come.
Well, it can't.
Things are going great.
Things are going great.
Happy holidays.
I'm interested from a psychoanalytic perspective.
Oh boy.
Are you having dreams over the last several months? Is there any pattern in your dreams?
They're fleeting.
You don't remember them? They don't really stick around?
No. They're whatevs.
Because I would kind of think like maybe there could be some insight there.
Like, if you could see, Brett is just like full on therapist, like combing his beard. Like, it's so crazy.
I would be a good therapist, you know?
You would, but this is not therapy. This is
have this when I cross my legs like this and stroke my beard.
Well, the funny thing is, you also you have this like shadowy like eye-ness where it's just like your eye glimmers and it's really like searching.
Is it sexy?
A little bit.
What do you mean searching?
Let's pause it.
Take your pants off.
Yeah, it's inquiring.
I'm gonna make you come.
Your eyes look inquiring.
I'm gonna make you come.
No, dude, it's like fucking. It's like just gripping a balloon knot.
Okay, so derealization, no dreams, can't come.
Mm-hmm.
I don't know how to help you, man.
I'm not asking for help. I'm getting by.
I mean, I really wonder what will get you over that fucking hump.
Dude, I need to. I feel like I have this crazy thing.
I think step one is stopping the DXM.
Here's the last thing. I
don't know if that's occurred to you, but
no, I know, no. That's the struggle. But here's the last thing.
Let's get addicted to weed, dude. Go ahead.
All right.
He doesn't like that.
Yeah. I almost have this weird feeling of like, dude, what if January or December 31st comes? I will almost feel like I'm gonna have this anxiety of like something's gonna happen.
Really? Why? It's the
Almost
anniversary?
Slightly. Yeah.
Of what?
Of the night that the last time I drank, and then when I went and did DXM for the first time.
Oh yeah, so we're coming up on a year of your DXM journey.
Journey is a nice way to put it.
Yeah. So what are you scared of exactly about that?
Not scared. I feel weird because I feel like, ooh, is something gonna happen? I was like, ooh, David, these are fucking crazy thoughts. These are crazy thoughts you're having.
I don't know what to say to that.
No, and that's all. That's all, folks.
Just some weird question mark of what if on the 1 year anniversary, some weird feeling that something might happen.
Right. No, there's no. It's just like a sense of like looming. It's looming all over the place, dude. Laura Loomer.
Oh, Laura Loomer. That's a deep cut.
Yeah.
She's at the highest echelons of power now. Your mood swings, your depression that just happened 2 weeks ago. How has your depression and your mood swings been since you got released from the hospital?
It's better. It's here's the thing that's been really tough. It was during the probationary period when I had to go to the hospital. Mm-hmm. I was separated from my job.
Really?
Yeah.
God damn it.
Yeah.
Because you had to take time off?
Yeah, and it was because like they're like, and it was like
Fuck, man.
I know.
Sorry to hear
one of those things where they kept thinking it was like, because the job. I was like, no, I can do SAT all by myself. It's not about the job. Like, but they just, I mean, I guess rightly so.
God
like but yeah. So that was, I really like that job, and so that's been tough. But I had this mentality where it's just like, we're gonna keep going.
Mm-hmm. Got to.
Yeah.
Because I mean, things are shitty, but like, given enough time, things have to switch around. Things have to move and morph, and things will get better with time. But I think you got to give your brain a break from any substances, and easier said than done, of course. And then just like fucking thug it out, like just fucking weather the storm. Mood swings, depressive episodes, they come, they go, and just try to find that place in you that can just fucking let them come and go.
Yeah.
I don't know. It sucks because every fiber of your being wants to resist. It wants to escape. It wants to get away.
Yeah.
But I've been, my whole mental health journey is like really centered on, especially lately, and I've talked about this before, but just on this radical acceptance of whatever I'm feeling is okay. Whatever I am feeling, good, bad, or ugly, is okay.
Yeah.
And I'm not going to resist it. I'm not going to fight it. I talked last time on the episode, I don't know if we even released it. It might go out on our Patreon where we did like a little episode that never got quite released, but I was talking about my somatic shifting, where I have these physical bodily symptoms that are inexplicable, and I go to the doctor for them, and they say there's nothing wrong with you, and they morph and they change.
Yeah.
And so, like, just like, it's trying to scare me. It's like when you're getting better at the OCD thing, so like, the clicking in the ears, blah, 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 everybody knows about that. So I'm starting to be accepting of it, it's starting to intrude in my life less and less, finally, after fucking 6-7 months of this shit. But precisely when I do that, the OCD, whatever you want to call it, tries to grab onto something else to scare me. So it's like, oh, this ear thing isn't scaring you now.
Yeah.
So let's find something else, and it literally psychosomatically creates symptoms in my body to see, does this scare you? Does this scare you?
It spins the Rolodex and chooses a new thing to do.
So blinking is one of the things, like with somatic OCD, like breathing, blinking, swallowing. Those are the big ones.
Yeah.
So blinking's trying to grab. I literally feel blinking trying to sink in. Like my OCD being like, okay, you notice you're blinking? Is that uncomfortable? Yeah. But it doesn't really scare me because I know there's nothing wrong. Only thing that can really latch is when I think something might not be right. So with the swallowing and the ear click, I'm like, the ear click is too loud. It shouldn't be like that. And that scares me. There's nothing in my blinking that can really latch because I don't feel like anything is wrong with it.
Right.
But then I get a lot of ab pain, gastrointestinal issues shifting around in my stomach, and like this pressure in my groin. And it's never multiple things at once. It's always trying a new thing out, and that's the symptom. The other symptoms don't exist. So when I'm dealing with like the pressure in my groin that feels really weird, but it's hard to explain to a doctor, I'm not noticing, the other things.
Right.
It's just so weird. But this is like radically accepting that what's here. It doesn't fucking matter. I have to totally fucking accept that these uncomfortable and even scary physical symptoms that I can't explain, that the doctors can't find a reason for, are happening. They're cycling through my body, and I just have to stop letting that get me upset. I have to radically accept that that's there. And I think something like that with your mental health, your mood swings. I feel like shit today. Yeah, you feel like shit today. You felt like shit many days in the past. I feel depressed today. I've been depressed. I know how that is. I literally know from day to day, some days my mind is much more calm, stable. It's okay. I'm like baselining it, and then like the very next day, for no reason, I will just feel more anxious, more shitty. The next day I'll feel like kind of like depressed. This depressed feeling will come and go. And there's this deep urge to try to fix it, try to understand it. Like, why am I depressed today? What the fuck did I do differently? What did I eat last night?
Yeah.
And that right there, that I need to fix this, that perpetuates it. Because then you're kind of telling your brain, this is a problem. It needs to be fixed. How can I fix it? How can I fix it?
Right.
And so that's that Rubik's Cube metaphor I always use.
Yeah.
He's got to set the fucking thing down and say, it doesn't need to be fixed. It's here right now. It's winter in my mind. It's a storm in my mind right now. A brainstorm, Let it come, let it go. I'm going to focus on other things that I actually want to do. But I don't know. I feel for you. And it fucking sucks. And I didn't know that you went to the hospital.
Yeah.
I don't know. I really, really, really hope that you can kick this DXM shit But losing your losing your job has to be fucking really shitty.
That was hard. But
what's your plan now?
I'm probably gonna move to Hollywood and be an actor.
Fucking nice,
to
dude.
make.
Nice.
I have had a couple of interviews. I have some that went well, and then I have one they scheduled it far out, but it's a good prospect. So,
you got some things cooking.
Yeah, I still got things cooking. But
last question on this, and we'll move on. When you're about to relapse on DXM, what is the feeling? What is the mood? What is the thing that pushes you in that direction?
It's,
acutely.
It's this sense of, man, we're not going to get through this without this.
Mm-hmm.
The day's going to be too long, and it's going to be like that tomorrow. And, it's full, like, putting on the blinders, just not thinking that, like, I'll work it in this way. I'll do this. Just is like,
there's no way out.
We're just gonna live for today, in a sense, and just grind through it.
Now, when that internal voice comes on and that those blinders go up, is there a part of you that knows what's happening, or do you get fully sucked into it?
No, I know what's happening, and it's just difficult because I just succumb to it in a way. It's like, kind of just like scratching an itch in a sense, where there's not, like I said, it's with addiction, it doesn't even have to be clever or very manipulative or anything. It's just pure blunt force, just the obsession, or if you're in a low state and it just feeds off that, and just.
Does it start with obsessive fixating on it?
Yeah, like basically what it will be is it's kind of like where that idea like that you had depression, I need to fix this.
Mm-hmm.
It will be that sense, and it'll be like, here's your antidote. Like it'll be like, honestly, if you had a headache, take Advil, stupid. Dummy, take Advil. Why are you not taking Advil?
And it works when you take DXM for the time you're on it?
Yeah.
Does it actually
chills me out.
It lifts your mood up?
Yep.
And calms your body?
Yep. That's a problem.
But then creates all new problems for you going forward.
Oh, yeah.
Like everything.
Oh, yeah. No, I know. That's, yeah.
Well, I'm with you.